Well, welcome to all of you. Thank you for joining. This is PCR Planet, where we gather news from colleagues and peers all over the world, and I will take you to Africa. It's my pleasure to meet and to welcome Dr. Hazem Khamis. He's running the cardiology service at the military hospital in Cairo, and he's also helping us with several outstanding PCR seminars in the country. I'm also welcoming Dr. Mpiko Ntsekhe. Mpiko is a director, a course director of Africa PCR, and he's working Groote Hospital in University of Cape Town, South Africa. So I'd like to start with you, Mpiko. Tell us, how is the situation of the COVID pandemic in Africa? Obviously, many concerns, but what's actually happening?
Right. So I would say, South Africa, of African countries or sub-Saharan Africa countries, has the highest number of patients that are tested positive so far. But we are still essentially in the medical services in what I would call the calm before the storm. We have really spent we're in the fourth week of our lockdown. We think we have flattened the curve, but it is the calm before the storm.
Mm-hmm. But you're prepared for it.
Yeah, we've spent this time reorganizing our services. We've cut back essentially on most of our elective operations, elective services, and outpatient services, and only focused on emergency services. So that keeps us as cardiologists busy, and high-risk outpatient activity. But it's the calm before the storm.
Mm-hmm. And on your side, how is the situation of the pandemic in Cairo and in Egypt in general?
Hi, William. Thank you very much. In Egypt, still the situation is stable. And just a few days, the number of cases diagnosed and mortality still stable. And the lockdown here only at night from 8 p.m. to 6 a.m. And we lock down the universities, the schools, but in the governmental authorities, only 50% of the employer in rotation day by day can go to their jobs.
Amazing. So, I mean, I've been to Cairo several times. It's such an amazingly busy city. So what you're doing, if I understand you right, you allow the economy and activity to go on during the day, but then there is full lockdown at 8 p.m.?
Yes. 50% of the economy all the day. All the people can go to their work, the private work and the governmental work. 50% of the employer can do their jobs through the day.
And I may have mentioned, but I know you are also the manager of this hospital, this military hospital in Cairo. So can you tell us a bit about your experience of being, physician and manager and having to deal with this crisis?
Okay, the easiest way is to be the cardiologist, the interventional cardiologist, to do the procedure. But to be a general manager it is very difficult, because I have a very big hospital, 600 beds and 120 ICU beds. So we separated the hospital into two parts: a COVID section with 130 rooms and ICU, ventilators. And as a general manager, you must support the medical practitioner staff with the PPE, with all the devices, all the equipments. And there is no trading nowadays from outside the country. You cannot bring any drugs, any devices. So you must support the system inside the hospital to have a lot of ventilators, to have ECMO, to have all the facilities. It is a very difficult job. And also the infectious control department. Every day we have meeting from the early morning to check the requirements for the infection control department.
Amazing. Thank you for joining in this, these busy days. And on your side, Mpiko, you mentioned that I know your activity. It's massive load of patients waiting also many non-COVID patients, of course, waiting for care. Must be difficult to manage expectations. And how do you see the future? I mean, you're creating enormous waiting lists, I guess, by redirecting all the resources to COVID patient treatment.
Yes, it's a major issue, William. We can't get around that. You know, before COVID, we already had very long waiting lists across the board. It doesn't matter what discipline. So, you know, our cardiac patients, elective cardiac surgery was, patients would wait between 3 and 6 months. So by canceling all elective cases and having us on the cardiology side still continue with our seeing of patients and doing the diagnostics of valve disease and patients with complex coronary disease that we still send to surgery, you can imagine that it's had major implications. So we've divided our services predominantly into a COVID service and a non-COVID service. And for now, given that, you know, we are still, like I said, in the calm phase from a patient load perspective, it's meant that most of the patients that we've seen don't have COVID as cardiologists. We haven't had to split our cardiology team much. I understand in the West, you know, we were speaking to Hazem and company where many cardiologists have had to shift tasks and go and help in the front line. We are not there yet, but like I said, we are fully prepared for whatever eventualities on the horizon.
Mm-hmm. Thank you. And on the social aspect, I know that the president and the authorities have declared a pretty, you know, serious lockdown of the entire country. So I suspect this must create huge difficulties in areas where, you know, it's very difficult to confine people in a way.
Yes. Again, you know, the lockdown around the world has had very different implications. Certainly in South Africa, and this is true of much of sub-Saharan Africa, we've got very large proportions of our population that live in what I would call suboptimal housing, informal settlements where you have, you know, 5, 10, up to 15 people in very small dwellings. Food security is an issue. People live day to day. Water, clean running water is an issue. And there just isn't the security of space to be able to have an effective lockdown. So the implication in communities like that has been, had its major consequences. It's been very, very socially disruptive in ways that I think the global north hasn't quite appreciated or hasn't had to experience. So that's definitely been our major consequence of the virus for now. Ironically, it hasn't been in lives lost or burden on hospitals and ICUs. It's really been this socially disruptive component of it.
Yeah, the situation is difficult everywhere, but of course in areas where there is poverty and you know, situations as you described, it's even more so, of course. Yeah, you're doing great work there. And Hazem, you mentioned about the fact that the country is closed, etc., but at the same time, you have interest in, and I think there is also interest from the government to promote trials and to make sure that you can contribute perhaps to evaluating new therapies. Can you say a few words about that?
You know, we have isolation hospitals for the COVID patients. 15 hospitals all over the country, and the number of diagnosed cases until yesterday, 3,333. So the Ministry of Health put several trials for those patients to be published, for the drug therapy, for the technical ventilation, for the group of the patient who deteriorate, who not deteriorate. And we have a very good study about the patient taking S inhibitor or ARBs, because there is some thought about the these receptors for the COVID patient. We have 2 trials about the new antiviral drugs, the effect of Plaquenil about the co-workers. So I think 8 papers, 8 trials with the multi-center international, with Japan, with many parts all over the world. We involved in this trial. I think it will be very important for COVID patients.
Yeah, it is important, and you know, we used to think that the results of trials done in the West can apply worldwide. That's not always the case, as was shown by many studies, and Salim Yusuf, of course, has been a pioneer from this perspective. So it's great that you can contribute to you know, establishing new therapies. So I would like to thank you for joining and taking time out of your busy schedules. And to finish, maybe I'd like to ask each of you to say a few words in conclusion, or maybe share a key message that you would like us to send out to the world and to the colleagues everywhere. And maybe Mpiko, you may want to start. Mpiko, thank you.
Okay, yeah, no, I would have two messages. One really is just to join the global chorus, really, in expressing my appreciation and respect for our colleagues and other essential workers around the world who are sacrificing so much for the good of society. And so I want to say I really appreciate and respect that, and long may the courage and bravery continue. And then, of course, to the other side of the coin, which is the many patients that have lost their lives. And like I described earlier, the many patients whose lives or livelihoods have been so disrupted by this epidemic. You know, the admiration for their perseverance and resilience, and hopefully there's light at the end of this tunnel. Yeah.
Hazem.
Thank you, William. I think we have some messages. Number one, the safety. We must be safe for the patient, and very, very, very important, the healthcare practitioner. Very, very important, especially in countries like Egypt. The second, we must continue. We must have the possibility how to continue in this situation. Care of the COVID patient, and not forget the normal patient or the other non-COVID patient, because this is very important, because we are suffering now. Many patients cannot find place to do the elective procedure, some elective procedure, and this is very important. And the caring of the people, because I think the economy and the suffering people in the near future will have another problems, another disease of the economy, not for the healthcare.
Well, thank you for sharing your views. Congratulations, and for all your work, and also thank you for concluding with some words of hope. For sure, the world will be different about this, but we're looking forward to see each other again very soon, and not just digitally. So let's stay connected. And thank you again for joining.
Yeah, and thanks for having us.
Thank you, William. Thank you very much.